It is critical that we address all of the needs of the patients, not just the physical. Attention to spiritual distress is a human right as much as attention to physical, emotional, and social issues. Ultimately, I think the foundation of a healthy, healing system of care is spiritual. Our aim is to integrate interprofessional spiritual care into health systems globally, locally, but as a standard of care, as a way that we can address patients' spiritual issues as an integral part of their care. Spirituality is the way that we search for deep meaning, that ultimate meaning, purpose, and transcendence, and how we connect to the significant or sacred, however we understand that. For centuries, it was the shamans and the healers and the Native American medicine men and women and the religious leaders and the spiritual leaders that were very involved in the care of human beings. But there was a dissociation in that, and that happened in the early part of last century as science became more prominent. For very good reasons. I totally respect science, but it seemed that we moved away from that more holistic approach. And there's a coming back to that. Whatever discipline we're in, we provide good care, all care to the whole person, and by the standards in our profession. Every patient gets some sort of spiritual assessment. So what does that mean? If we find out about people's resources of strength, say their faith is important, or they meditate, or mindfulness is important, that gets written in the chart and gets supported. If the patient wants that supported. If it's someone that is dealing with a lot of suffering and distress, that gets identified and attended to, not just identified, but and attended to. So ideally, I think there should be an interprofessional team. There should be ready access to spiritual care professionals in the outpatient as well as the inpatient setting. It's the choosing of our words carefully, and accompanied by our gestures of support and love. That's what I think we need to bring, and that's what I think spiritual care is. Spiritual care is ultimately respectful care. It's at the core of respectful care.